Well, we've been talking about how COVID's impact is on the mental health of people. So many people affected, and those with eating disorders are also impacted. Joining us to talk about this is Dr. Jennifer Downs, a psychiatrist with Hartford HealthCare's Institute of Living. Doctor, thank you for being with us.
Thank you so much for having me.
How has COVID impacted eating disorders? What do we know?
We're seeing an increase in eating disorders that's very much been associated with the pandemic. I'm seeing it here at the Institute of Living and at Connecticut Children's Hospital, where I spend most of my time caring for teens with eating disorders. But we're also seeing this nationally and even internationally. There was just a paper that came out in the scientific literature about how even Australia is seeing these same increases in eating disorders that we're seeing. Currently at Connecticut Children's Hospital, we are on pace to double our eating disorder admissions from the year prior.
Oh, gosh, that is heartbreaking. What are some of the triggers, signs, or symptoms of an eating disorder?
So a lot of the signs of an eating disorder start off looking like picky eating or even some healthy habits. Being more conscious about what types of foods you're eating. Many teens and young adults dealing with this disorder may begin by cutting carbs and fats out of their diet. And then what you'll notice is that these eating habits cross over from something that was healthy or maybe a little picky into a dangerous range, where they're now cutting significant amounts of food out of their diet, entire food groups, skipping meals, and losing dangerous amounts of weight.
Oh, sorry, I just had a frog in my throat. What kinds of treatments are available?
So there's a variety of different treatments available. What they all have in common is that they will involve a pediatrician to monitor your weight, or a primary care doctor if you're an adult, a nutritionist to help you plan your diet to make sure that you're getting all the different healthy food groups you need, therapists to help you with the mental piece of this and overcoming some of those cognitions that make you not want to eat food, that give you the false impression that your body needs to lose weight.
All right, if someone thinks they or someone they love is dealing with an eating disorder, what's your advice?
My advice is to start talking about it and get help immediately. This is a treatable illness, but it does take quite a high level of intervention, and you do need that whole support team around you. So start with your primary care doctor. Tell them what you're worried about. Ask them to track weights with you. Ask them to get you some support from a nutritionist and a therapist. Start putting together a care team right away.
All right, Dr. Downs, thank you so much for joining us.
Thank you so much.
All right, kids have been out.